Howdy folks, this is Dr. Gabriel Sines. This week we're looking at psychological disorders. There are so many psychological disorders, and your textbook focused on just a very few of them, to be honest, and I disagreed entirely with the way it was set up. So the way we're handling this week is we'll start off by looking at what disorders are, what qualifies someone to be experiencing a disorder, and then we'll take a look at disorder groups. There are many disorder groups, and it would not really be helpful to provide a more in-depth outlook on what the disorders are. As we go on, you'll see what organization I've used, so it should become apparent if you're interested. The quick and dirty on that is we're following the order in the DSM-5. So let's get started, and you'll soon know what the DSM-5 is. Okay, so first, what is a psychological disorder? It's a syndrome marked by clinically significant disturbances in a person's ability to live normally, to function at an acceptable level. We've talked about this before in different ways. In psychology, a dysfunction or disorder is not one where you are weird. There's no such thing as a total normality in psychology. Instead, psychology assumes that every person is slightly different. Consider then what would qualify you to have a disorder? Well, there are many different ways that you can have a disorder, and a few of them are pretty weird. There's a wonderful there's a wonderful book named The Man Who Mistook His Wife for a Hat, written by a psychologist who interacted with many people with very weird disorders. In this case, a man had a problem recognizing the visual information of his wife as a person and as his wife. Instead, he considered it to be a hat. So there's some sort of pattern recognition problem, probably stemming from the sensory memory to the working memory, before the working memory, definitely, resulting in an inability to consider the situation properly. Now, there are many people in this book. There are people who have amnesia. There are people who believe themselves to be persecuted by the government, to experience paranoia. And the way that psychologists diagnose these issues is using a book called the DSM, the Diagnostic and Statistical Manual of Mental Disorders. And it's called a Diagnostic and Statistical Manual because it includes two things. First, information on how to identify what a mental disorder is and whether or not you have it, as well as the severity. The statistical manual includes information on part of the manual includes information on the likelihood of a disorder. How likely is this disorder for boys versus girls, for people in the United States, for people of different ages? It explains, it gives you kind of a coloring in of the surrounding qualities that a person with a certain disorder might have. So, what is the organization of this book? Like I said, it's full of a series of disorder groups, but what qualifies something for a disorder can be very difficult to say because disorders are so different and people are so different. A wonderful way to do it is something called the 4Ds of abnormality. In psychology, we don't necessarily use these 4Ds, but they're a good sort of quick method to assess whether there's a problem with a person. The 4Ds are distress, danger, deviance, and dysfunction. First, D, distress. Distress stands for if a person is unhappy with their state of being. Let's say that you have 6 fingers. If you have no problem with that, you are not experiencing distress. But if having 6 fingers makes you feel ugly, makes you feel weird, makes you feel socially outcast, if having 6 fingers makes it hard for you to feel good about yourself, that's distress. And it can come from lots of different places. But this is the first one because it is probably the most important one in the bunch. Feeling as though you have a problem is the first qualifier for having a disorder. The second, danger. If you're a danger to yourself or to other people around you, you are maybe experiencing a mental disorder. For example, being really, really drunk is considered a mental disorder. It is not considered a substance abuse, or it's just considered a substance use disorder because, you can get really, really drunk without ruining your lives. But in the span of hours that you're very drunk, you can be a danger to yourself and other people, which means that you would qualify for the danger aspect of mental disorder. Now, most disorders have a time component to them. Um, a duration of at least a couple days or weeks or months for it to be qualified as a disorder, because something temporary like being this drunk uh, is probably not a mental thing, it's probably biological. Other examples of danger would be a person who is, say, unable to accumulate enough money to pay for their rent because of their gambling addiction or because of their crippling addiction to Beanie Babies. Next up, we have deviance. Deviance is the weirdness component. If you are doing something that is unusual for the culture in which you are in, that is considered deviant. For example, we have here a man named Vernon Supreme who has repeatedly run for various offices. You may have seen him on the news and such. He's famous for wearing a boot on his head and running on weird platforms. He likes wearing multiple ties and dressing in funny, weird ways. Um, he is definitely someone who's deviant because none of those behaviors are common in the United States or of his age. But he doesn't qualify as having a mental disorder because he doesn't have any of the other Ds. And so it's important to note that you need to have at least a couple, 2, 3, or 4 Ds to qualify for having a mental disorder. There's no specific yes or no. You have a disorder, but having just one or two of them doesn't necessarily qualify you as having a mental disorder. Lastly, dysfunction. This one is a really easy one to point to. If something about your life makes it difficult or impossible to live, to function in society, that means have a job, care for your health, care for your friends or family. So dysfunction is the D associated with hitting rock bottom if you are addicted to alcohol or drugs. If you are addicted to playing video games and you can't stop playing them to the extent that you play them at work and you are unable to get your work done, like in this picture, that would qualify you for the dysfunction D of disorders. So uh, you can see that there's a little bit of overlap between these, but you can imagine that if you're trying to identify whether someone might have a disorder, you want to qualify for at least one or more of these. You might have dysfunction, danger, and deviance without distress, a person who feels as though there's nothing wrong with them, but qualifies via having those other three. Now, there are some caveats to these Ds. For example, it's important to consider what is normal in a culture or for a person. Uh, for example, the people of this culture, check out the link for number 5 at the bottom if you want to learn more, unbury their dead once a year to celebrate and remember them. They carry them around, they kiss them, they dress them. And you can imagine that that's kind of crazy. If someone did that in the United States, they would be in big trouble. That would definitely be deviant. But in their culture, it is not deviant, and obviously does not cause very much distress to most people. As long as they're doing it in a safe way, the danger is not a problem. In the United States, this would be dangerous, not just because of the medical implications of digging up a corpse, but also because you are breaking the law. And any time you break the law, that's going to qualify you for the danger component of the Ds. Another example of this is the differences in ADHD in boys and girls. So boys develop their concentration and a number of other traits more slowly than girls. So in school, girls are really not diagnosed with ADHD very often, but boys are, because girls are a little bit more calm and collected and organized than boys are. So it's easy for boys to be diagnosed with ADHD. That's attention deficit hyperactivity disorder, a disorder marked by inattention, hyperactivity, getting distracted, losing your train of thought, being unable to stay on task. Now, those are all qualifiers for being a child generally, but if you think your child may be overly distracted, they might have ADHD. The thing is that in girls, ADHD looks a little bit different than in boys because they do develop sooner or in different ways. For example, girls with ADHD tend to be more ditzy or daydreamy, and they may work harder to overcome those issues because they are more interested in the social aspect. They care more about their friends and what people think about them, so they're going to do their best to stay on task. So they're going to do the best to make sure the teacher is happy with them. Okay, so that's our first disorder, ADHD. Now we're going to see quite a few disorders, but we're mostly going to focus on disorder groups. So before we get there, I do want to mention one last thing, which is the idea of the medical model. The medical model is the idea that mental disorders are illnesses that can be treated, many of which, or all of which, are caused by some sort of biological issue, biological problem in your makeup. Now, some disorders are very, very clearly biological in nature. People who don't develop correctly in their infancy have some problem with their biology. People who have a nervous tic may have some problem with their biology. But there are some disorders that are more psychological. And so the idea for the medical model is not necessarily that people should be healed by doctors with medicine or surgery or something like that, although that is a possibility. Instead, the medical model suggests that mental disorders are something that should be cared for via some form of medical treatment. That means that they should be diagnosable, they should have consistent reasons that are causing them, we should be able to find treatments that consistently work for people, and that this is something that we should care for, so it should be part of their insurance and stuff like that. Okay, so that's it for this what are disorders thing, and we're going to get started now with neurodevelopmental disorders. Neurodevelopmental disorders are a group of disorders associated with developing your body or brain incorrectly, due most often to illness in early life or genetic problems. Neurodevelopmental disorders are most often identified as intellectual, personal, social, physical, academic, or occupational impairments, often leading to a failure or a delay in hitting developmental milestones. That sounds really scientific. So let me give you an example. We've talked about this before. People with intellectual disabilities, folks who did not quite develop at the rate they were intended to, or that most people do, may have some neurodevelopmental disorder, such as, for example, Down syndrome, and they qualify for the Ds. Let's use this as an example for qualifying for those Ds. They may or may not experience distress, but they could be a danger to themselves or others. They definitely they would qualify for deviance because many of them would not act their age or act the way that you would expect them to, or maybe look the way you would expect them to. And finally, um, shoot, I suddenly forgot what the last D is. Oh, dysfunction, of course. Finally, dysfunction is the one that really qualifies people with neurodevelopmental disorders, people who are unable to function independently to live on their own. For example, many people with intellectual disabilities require help in finding or maintaining a job. A friend of mine worked as a job counselor for a while, and her job was essentially to take their set of persons. So she would follow one person per day or two or three people in a day and take them to a job site and help them learn and accomplish their job so that after a number of weeks they would be able to work that job on their own without help. Um, Depending on the situation, that may or may not work for people, and unfortunately, some of those groups really are not very beneficial. They're just looking for free labor, and they're not really interested in getting a person to a place where they can work consistently. But that's what's going on here in this picture. For example, these folks are putting together some sort of mailing campaign, and it requires manual labor that would take a lot of time, and it's a job that they can accomplish and they can learn pretty quick to do. Okay, what other disorders can you get from neurodevelopmental problems? Communication disorders, being unable to speak, understand language, or produce language naturally. This is something I think it's pretty straightforward to figure out. A very common set of people who has communication disorders are people with autism. People with autism sometimes struggle to learn to speak consistently. And it's important to define autism. So autism is actually a spectrum of disorders, all associated with difficulty or an inability to recognize social information, like the facial expressions that other people are making. Another qualifier of autism is that those people with autism may have difficulty in focusing on different things in their lives. For example, they may be most interested in just one or two things and really, really focus in on those interests. Um, a big part of people with autism is they may struggle a lot to communicate with other people. They may be hypersensitive to certain types of information, or they may think in different ways. People with autism for a long time were pretty demonized. They weren't really considered people. And one of my most favorite examples of someone with autism is a lady named Temple Grandin, especially because she was super successful, because she worked her butt off to be an incredibly successful lady, and she was one of the first people with autism to go through a full education. She got a master's degree with her autism and became very successful. I believe she got pretty rich because she designed a number of things. I won't, do all of it for you, but I would like to encourage you to check out this link here at the bottom. You don't need to watch all of it, but there's a bit of an interview, and there's TED Talks from Temple Grandin. There's this movie where this actor here portrayed Temple, and so Temple is actually on the left there. She's a bit older than the actress, but she speaks very, very well. Uh, Temple Grandin had trouble with too much sensation, especially when she was younger. She would freak out, and honestly, which one of us doesn't freak out when there's noises that are too loud or lights that are too bright? It's just that there are different thresholds for people with autism. Um, One way that she was able to harness her personality and her status and her characteristics is that she actually developed better systems for corralling cows. She was better able to understand how cows think, and therefore was able to create these systems where we were able to treat cows more humanely and also make a lot more profit off of a cow herd by keeping more of them in healthier and living conditions. So there you go. I would really encourage you to watch the Temple Grandin movie. It's available in a lot of different places. Um, Another thing to be very aware of is that she did become a very outspoken um, motivator or speaker for autism. She's, pretty dang wonderful lady. It's important to note that autism is considered part of a spectrum, and there's lots of different subsets or qualifying characteristics for autism. You may have heard of Asperger's, sometimes incorrectly pronounced Asperger's syndrome, for people who have difficulty in social situations. That has now been grouped into the autism spectrum disorder. Uh, if you believe you might have Asperger's or you want to learn more about it, the quick and dirty on that is that Asperger's is a condition where you have difficulty relating to other people and interacting in social situations. And partially what's going on there is that people have this natural automatic ability to pick up on how other people are thinking and talking and acting and reciprocate without even thinking about it. It's automatic. People with Asperger's have a kind of a slight version of autism where they are less able to pick up on those things. They are less doing them less automatically, and that makes them nervous, which makes them less able to socialize, and it's kind of an unfortunate cycle. Once again, I really encourage you to learn more about people with autism. They have so much to give to our society, and they can be uh, really interesting folks. One thing I would like to mention here is the idea of comorbidity. Comorbidity is the possibility or likelihood that a person with one disorder has another or multiple other disorders. It's kind of like saying that people who have heart disease, that is comorbid with diabetes because they are both diseases associated to how much you eat. So if you are really, really overweight, there's a high likelihood that you could get diabetes and also have heart disease. So in psychology, we also have comorbidity, and so people who have neurodevelopmental disorders are likely to have other disorders. For example, folks with ADHD have a higher chance for depression and anxiety and conduct disorder, which has to do with being mad and fighting authority too much. And so you can imagine that although these are very related, they are considered separate, but they cause each other. They feed on each other. Excuse me. Okay. So we do have a couple more neurodevelopmental disorders. Neurodevelopmental motor disorder is kind of an umbrella term for a number of disorders associated with being unable to control your body correctly. There's lots of different ways that this presents itself. People who are constantly moving their arms or legs or head, people who have tics, people who move themselves with slowness or clumsiness. There are many different ways you could have a motor disorder associated with a neurodevelopmental problem. An example of this would be Tourette's disorder. Tourette's disorder being a condition most often associated with tics, where you move your hands or your face or your body in a way that is unusual, weird, sudden, and repetitive due to this disorder. Tourette's disorder is most often associated with people who have a verbal tic, which is you say something. Famously, Tourette's disorder, people believe that folks who have Tourette's disorder most often will say curse words or say rude things just kind of randomly or due to some sort of stimulation. That's true, but there are other forms of tics. For example, a lot of people who have Tourette's disorder will just kind of click, or they might suck their teeth like that. A lot of them will just shove their head around or kind of erratically. It is a condition that can be treated medically, and that is definitely one of those more biologically oriented conditions. But there is some psychological components to it. For example, folks who have Tourette's disorder tend to have their tics appear more often when under stress or anxiety. Uh, the last one here, included under neurodevelopmental disorders, is something called specific learning disorder. This is a disorder where a person is unable or experiences a lot of difficulty in learning a specific area of knowledge. So someone who is just unable to learn to write, just unable to learn to speak, just can't pick up math, something like that. This is going to be a really specific but possible disorder to have, and I just wanted to mention it so you can be aware of it. Next up, we have schizophrenia and psychotic disorder. Schizophrenia being probably the most iconic psychological disorder you can have. This set of disorders is characterized by people who have some sort of detachment from reality. So, delusions, hallucinations, disorganized thoughts and speech, we're going to go through a lot of these different detachments. There are multiple different ways you can deal with this, and there are a couple of other negative symptoms. For example, people with schizophrenia tend to experience depression and anhedonia a little bit more often, and we'll learn more about those in a moment. Schizophrenia schizophrenia and psychotic disorders are very genetically oriented. They are very much caused by problems in your biology, and there are many different ways you can deal with them. They do require therapy. They do require a lot of effort on the person to to deal with them so they can live better lives, but they also require medication, and so that's something that you're going to really want to intensely work with a therapist on. Just so you know, schizophrenia and other psychotic disorders, like I said, are very genetically oriented, so they are something that comes about because your family or ancestors have it, and it is something that starts to appear early in your life, but especially in uh, teenager to mid 30s is when you can get it. So folks who probably are learning this right now, you're right in that range where you can get schizophrenia. It's not a very common disorder, however, everyone will experience bits of it during their lives. And the important part is to be able to get through those bits. The first example of a detachment from reality is a delusion. A delusion is a persistent belief that cannot be changed in the light of conflicting evidence. So people with schizophrenia might believe that they are kings when they actually aren't. They might believe they're the president. They might believe that they are wanted. They might believe that they are like wanted by the government, being hunted by aliens. Maybe they have paranoia. These delusions can cause nihilism, like a feeling that nothing really matters, or feeling out of control, because this disconnect from reality can make you kind of lose your mind. Not only are you having trouble identifying what is real, but because there is a discordance in the reality of your perceptions, you might start to have trouble in other areas of thought. Delusions are a dangerous place to be, and many people will experience a delusion at some point in their lives. So the important thing to take away from this is not necessarily how scary schizophrenia or psychotic disorders can be, but instead that a very, very well functioning person is someone who tries to pay attention to facts and is willing to change their opinions when they are given that suitable information. Catatonia is another kind of terrible condition you can have with schizophrenia or psychotic disorders. Catatonia, very simple, is a loss of control of your body, most often associated with having a very still body or having like you get your arm moved in a certain way and it just kind of stays there. People with catatonia sometimes are just totally doll-like. They've completely lost control of their body and they don't really talk or move or even blink sometimes. There's a video here with a couple of actors showing catatonia. If you would like to, you may check it out on the internet. Catatonia can affect not just people with psychotic disorders, but you can have catatonia if you get too depressed, actually. If you're so unmotivated by life and there's nothing that gives you joy, your body can actually start to shut down to the extent that you don't have the motivation to move or to blink, and you fully detach from your reality because you are just that depressed. Next up, anhedonia, which is a state of being unable to feel joy. It's the hallmark of depression, and we kind of just mentioned it. People with psychotic disorders may feel anhedonia because they are unable to identify reality. And so if things aren't real, if things don't make sense, it's very easy to fall into this terrible place where you stop caring about anything, you stop finding joy in things, and so you just have to survive. Okay, next up, bipolar and related disorders. This is going to be the disorders associated with, you heard of this before, manic depressive disorder. This disorder or group of disorders is characterized by manic episodes. A manic episode, kind of like on the left, is when you experience for a day or more, or several days, sometimes even weeks, a period of extreme energy. People experiencing manic episodes may work all night. They may get all of their homework done and even the homework for the rest of the semester done in a couple of weeks. They may, apply for a lot of different jobs. They may work really, really hard. They might write a whole book or something. I don't know. They have all this energy and a lot of drive to get things done. But all of that has to go away sometimes, and they do get exhausted. And so, most often, if you have manic episodes, you will also have depressive episodes, a period of extremely reduced energy, loss of emotional function. we'll learn more about what depression looks like. But you can imagine it's essentially extreme exhaustion, physical and mental and emotional. And so bipolar disorder is something that a lot of people may relate to because, everyone experiences periods where they're really tired and can't get anything done, as well as periods where they're really really motivated and they're managing to stay on task and they work all night on something. It's Bipolar disorder is not something that you have if every once in a while you're really motivated and sometimes you're really depressed. It really has to do with a level of manicness that is debilitating. Um, you can imagine that this is really not a fun place to be, but unfortunately, quite a few people will diagnose themselves with this or something like this. This is the one that I've seen quite a few psychology students identify that they might have. And at this point, I want to take a moment to talk about self-diagnosis because it is a real problem and it's a real dangerous thing to do. Self-diagnosis, as it sounds, is when you identify yourself with some sort of disorder or a disease. It doesn't have to be psychological. The thing about self-diagnosis is that it's very dangerous. Why? Because if you constantly are looking to identify what's wrong with you, you will find something, and that can be a very anxiety-causing thing. Another thing is that if you do think you have something and you diagnose yourself, you shouldn't deal with it on your own. You should find treatment. And most people do find treatment, and they look for treatment in different ways. Another thing is that they may use this as a crutch. Now, inherently, there's nothing wrong with self-diagnosis. The best thing to do about self-diagnosis is to, if you think you have some sort of disorder or have a problem, look for information online, but use it as a first step before you self-refer to a therapist or a doctor, because there's nothing wrong with learning about what conditions you may be feeling and what symptoms you may be feeling, but trying to live with it on your own or solve it on your own, it can be problematic. It is super common for psychology students to diagnose themselves or their friends or their loved ones, and that is really a mistake. Uh, a final point there is that if you feel as though you want to diagnose yourself or your friends, it's incredibly difficult to do so because it's not possible to be objective about the diagnosis. Objective meaning, are you looking at the situation based entirely on the facts, or are your feelings getting in the way? And so if you're diagnosing yourself, it makes sense that your feelings get in the way of thinking about yourself in a clear-headed way because you are looking inside. And so really a diagnosis for any disorder would require that the disorder is clear and present in multiple aspects of your life. And so it may not be seen by different people, but information they have may help diagnose it. And so the conclusion I want to get here is there's nothing super wrong with self-diagnosis, but that is especially true if self-diagnosis is the step before self-referral, not the step before self-treatment. Okay, let's move on. Next up, we have depressive disorders. Depressive disorders are the group of disorders associated with depression and anhedonia, feelings of sadness, emptiness, irritability. These can be associated with changes in your body and your senses. For example, you may feel extreme sluggishness. You may feel pain more acutely. Everything might hurt. You may feel demotivated to do anything. Depressive disorders really are when you stop feeling joy in things to the point where you can't live your life anymore. And it is an incredibly terrible disorder to have. There is a wonderful video about this by Dr. Robert Sapolsky linked at the end in the extras section under number 6, and I'd like to encourage you to check it out. Next up, disruptive mood deregulation disorder. It is a part of depressive disorders, and it is specifically most often found in children. Basically, it is a disorder where children are unable to recognize authority, and they are constantly in a state of behavioral discontrol. The reason that children with this set of symptoms that are constantly acting out, angry, yelling, fighting, throwing tantrums, are considered to be depressive instead of like manic is that children who have this set of symptoms tend to develop into a depressive person instead of into a manic person. And so what's going on here is that the children are experiencing a form of depression, but instead of becoming really, really sad, their naturally energetic bodies are making them feel uncomfortable, and they react to that by being disruptive and tantrumy. Okay, anxiety disorders. Of course, anxiety disorders are a set of disorders that pretty much everyone is going to feel to some extent. They are disorders characterized by excessive fear or anxiety relating to some sort of behavioral problem. And this is the most common type of disorder that we have in the DSM. We're going to look at a couple of different types of anxiety disorders, but the important qualifier for an anxiety disorder is that it is more than just anxiety. It is okay to be anxious about getting some test results from a doctor or your test grade. It's okay to be anxious about taking your driving test, or about being anxious when you're listening to music that you can't relate to, or that is too loud or too bright. What a disorder is anxiety that is constant, anxiety that interferes with your day-to-day life, and anxiety that makes a danger to yourself. If you can't go to work because you're feeling anxious, that is dangerous. And so, again, this is one of those places where the 4Ds really can help you differentiate between a normal level of anxiety and a disorder level of anxiety. Phobias are a very common and, well, not necessarily very common, but a very widespread form of an anxiety disorder. A phobia is a condition of extreme fear associated with some particular stimulus. So you may have aerophobia, fear of flying in a plane. You may have um, uh, arachnophobia, probably the most common one, fear of spiders. And we'll learn about agoraphobia in a bit, but it's kind of fear of open spaces and other people. There's also mutism and social anxiety or phobia disorder. Mutism is where you are unable to speak or choose not to speak to certain people, or to this is very common in children who have experienced some major problem or anxiety. They may just never speak outside of the home. Social anxiety is a pretty common thing that most people are experiencing, but the place at which it gets to a disorder is when it really starts to prevent you from living a normal life. Social anxiety is going to be fear or anxiety about being judged, likely leading to people avoiding social situations. I've definitely gotten to a place where I was in a social anxiety place that was bordering on a disorder, I would say, because I would avoid going out to social situations. I would sign up to go to mixers, and then I just wouldn't go because I didn't think I would have a good time. I didn't think that I would belong there, or that I would look good, or anything like that. I was afraid of meeting new people. These people with these disorders might have a lot of fear associated with going out with other folks and eating or drinking or meeting new people or performing in front of others. And anxiety disorders are most strongly associated, or social anxiety disorders are most strongly associated to a fear of some sort of embarrassment or humiliation or rejection, or of offending other people. So if you avoid other people because you are afraid of what might happen, that could qualify you for a social anxiety disorder. Okay, so here's agoraphobia. Like I said, it's the fear of leaving your home or being in an open space where you cannot easily leave, being in an enclosed space outside of your home. I had a friend who had agoraphobia. He had a kind of a very sad story. He was falsely accused of raping a girl and getting her pregnant. The true story was that the girl did get pregnant, but she did not want to, uh, accept that it was kind of just a bad choice on her part. And so there was this huge trial, and he was in trouble for a number of years, and eventually all of it came out. But this left him in this place where he was afraid of leaving his home, and he's afraid of other people. He was unable to go to the local market. He was unable to walk down the sidewalk. And so he was like that for quite a while. I don't think he sought treatment. Eventually, he one day just got so fed up with himself that he just went outside and had a walk and started getting better from there. But it was a big uphill battle for him. And so agoraphobia can be an incredibly terrible place to be. One great thing about the present is that now we have Therapy, kind of like, teledoctors, where you talk to your doctor or your therapist online, and that can help folks get over their agoraphobia with help of their doctor without having to leave their home yet. Okay, panic disorder is almost exactly as it's named, a disorder where people experience panic attacks often or in response to certain things, such as panic is a intense surge of unavoidable fear to the point where a lot of people may basically shut down, be unable to do anything because their body is totally racked with fear. Panic becomes a disorder when it happens in nonsensical ways, and it happens often to the point where it can be disruptive to your body. Generalized anxiety disorder, I think it might be the last anxiety disorder we're talking about here, is a form of anxiety where you experience long-term debilitating anxiety. So anxiety can be very tiring. So this can make you depressed. It can make you tired. It can hurt you, actually. If you have too much anxiety, your muscles can tense up all the time, and then you can be in constant muscle pain. You may be unable to sleep properly. Now, the difference between anxiety disorders or generalized anxiety and panic attacks is that panic attacks are many individual attacks of panic. Anxiety disorders or generalized anxiety disorders is a lower level but constant stream of anxiety. And so we have here a nice chart. I would recommend you check this one out on your own and think about it in your own life, whether you have experienced anxiety attacks and whether you've experienced panic attacks, because a lot of people kind of get them confused. An anxiety attack intensifies anxiety for a period of time, say a few, sometimes just a few moments, up to a couple hours or maybe days. A panic attack is something that really just lasts minutes, at most maybe a few hours, so not as long lasting, and it has a lot more of these intense physical symptoms associated to them. And so it can be very easy to go down an emotional spiral, as one of my friends likes to call them, where you are unable to calm your emotional storm in your head, but that would be considered an anxiety attack, something that's getting worse and worse and worse over a period of time where you can't stop thinking about what might happen or how silly you are, or something like that. A panic attack is, if you want to think about it this way, an anxiety attack is kind of a slow burning of your feelings, whereas a panic attack is a sudden hot flash. Okay, yeah, we do have a couple more anxiety disorders. These are looking a little bit different. Sorry, we have a new set of disorders here called obsessive-compulsive disorders and related disorders. Obsessive-compulsive disorders, most often associated with OCD, are a series of disorders associated with obsessions, recurrent persistent thoughts, images, or ideations, things in your head that you can't stop thinking about, and compulsions, repetitive behaviors or mental acts that people feel driven to perform in response to an obsession. So a very simple way to explain this is that you have something that you are obsessed with, or that becomes an obsession, and you often react to it in a compulsive sort of way. So people who are like extreme germaphobes may be uh, uh, obsessed with getting sick or making sure themselves are clean. And so they would react to it by washing their hands, by cleaning their houses compulsively, by taking their vitamins compulsively, or a series of lots of different supplements. This is kind of an anxiety disorder because the obsessive thoughts cannot be stopped, and they cause anxiety, leading you to do the compulsive behavior. The unfortunate thing about this is that whenever you're spending time washing your hands over and over again, or cleaning over and over again, or exercising compulsively, what you're doing is you're feeding into your problem because you are fixing it instead of dealing with the fact that, well, there are germs everywhere, and sometimes you'll get sick, but that's okay. A little bit more information about obsessive compulsive disorder. We've got 1 in 200 children has OCD, or 1 to 3% of the population in the United States. And we have some examples of obsessions and compulsions. If you want to check that out, You may, but here's another example of an obsessive-compulsive disorder, body dimorphic disorder. This is a condition where you don't see yourself in an accurate way. You see yourself as really ugly or really fat or with too many wrinkles or something like that. And this causes you to constantly check your appearance, constantly preen yourself, constantly have surgery, constantly be dieting. So the obsession with how you look is going to result in the compulsion to do something about how you look. This is a disorder that everyone, like I said, everyone kind of has a little bit of body dimorphic disorder, but it's not a disorder unless you are, spending all of your money on it or hurting yourself due to it or something like that. Once again, refer to those 4 Ds. Here's an example of a disorder that clearly becomes problematic when you break the 4 Ds. Hoarding is a compulsive disorder where people are unable to discard their possessions because they feel like they need to hold on to them. It becomes a disorder when it really hurts your life. People with hoarding may have homes that are so messed up that they are unlivable, that they cause sickness, or that kill them right out. There's a story about a pair of brothers, one of which who got stuck in their pile of garbage in their home and died. And then they were partially eaten by cats. Feel free to check this out. It is quite a terrible story, but causes a lot of morbid curiosity. I'm sure you're familiar with hoarding, but it is an obsessive-compulsive disorder because people are obsessed with holding on to things and they compulsively keep them to the point where their lives become garbage. Here's another obsessive compulsive disorder, very much associated with anxiety. Picking. Picking is where you scratch at yourself, you pull the bits of your lips, you bite your teeth, or you scratch at your nail. Sorry, you bite your nails, or you scratch at your nails, or your cuticles to the point where they become damaged. Picking is a very common thing to do. Uh, you know, I myself do it on my nails, but I've gotten pretty good where it doesn't hurt me. And the problem with picking comes when you're damaging yourself, when you're hurting yourself. And so again, refer to those 4 Ds to identify what may be a traumatic level of picking. And picking is a symptom of some sort of anxiety or obsessive compulsive disorder, so feel free to check it out, see if you may want to relate that to something else more specifically. Okay, we're about at the halfway mark, so I'm going to pause the video here and we'll come back next time to look at trauma and stressor-related disorders. The most obvious association with that is going to be PTSD. So we'll be back in a moment.